Mens sana in corpore sano. This ancient dictum from the Roman poet Juvenal is indeed a reminder to us all on the importance of a healthy body and mind to ensure that a person lives life to the fullest with vim, vigor, and wit. Accessibility to quality public health care has been a challenge in many remote areas of India, be it availability of resources or the state of technology for whatever resources are available. Take, for example, the seemingly basic facility of diagnostic labs, which to many of us city dwellers may seem omnipresent. In most remote towns and villages of India, there is no network of diagnostic labs or home collection, and hence the residents of those places must travel far to the nearest such facility, which are usually available only in the district headquarters. Often, due to the burden of such travel, patients choose to not undergo the diagnosis, which exposes them to the risk of carrying a disease that may even be life-threatening without further treatments. To address these challenges, Konica Minolta Business Solutions India is striding towards making healthcare and its advancements accessible to all. Konica Minolta India has launched its CSR project, Aarogya, by supporting healthcare with 6 health diagnostics ATM machines at various community health centers and public health centers, also known as CHCs and PHCs in a remote part of the Vadodara district. These health ATMs help the patients get instant results for over 60 invasive and non-invasive tests with 95% accuracy and zero cost.
આવા મશીનના ઉપયોગથી દર્દીને તાત્કાલિક સારવાર મળી રહે હેતુથી અને દર્દીને નિદાન તાત્કાલિક થાય અને એના મોબાઈલની અંદર જે વોટ્સઅપ નંબર આપણને મોબાઈલ નંબર આપે એના વોટ્સઅપ માધ્યમથી એને રિપોર્ટની જાણ થાય અને એનો ઉપયોગ કરવાથી તાત્કાલિક નિદાન થઈ મોટા દર્દથી એ બચી શકે છે. એનું પણ આ એટીએમના માધ્યમથી લાભ થશે.
These include tests like malaria, dengue, chikungunya, hepatitis B, COVID-19, blood glucose, ECG, lipid profile and many more.
ये मशीन में एक ही टाइम में एक ही लाभार्थी यानी पेशेंट का हम नॉन इन्वेजिव पैरामीटर्स ब्लड प्रेशर, सैचुरेशन, बॉडी मास इंडेक्स, बोन वेट इत्यादि पैरामीटर्स को नापा जाएगा. इसके अलावा लैब इन्वेस्टिगेशंस जिसमें हीमोग्लोबिन, रैंडम ब्लड शुगर, HbA1c जो डायबिटीज़ का टेस्ट है और लिपिड प्रोफाइल जैसे आधुनिक टेस्ट भी किए जाएंगे. इसका फ़ायदा यही है कि जो दूर दराज से जो पेशेंट हमारे यहाँ पे आते हैं, अलग अलग तरह की बीमारियाँ होती है, डायबिटीज़, हाइपरटेंशन, वो सभी दर्दियों को एक ही प्लेटफॉर्म पे एक ही जगह पे ये सब टेस्ट निःशुल्क मिल जाएंगे. और खूबी यह मशीन की खूबी यह है कि ये सब टेस्ट का रिज़ल्ट भी उनको व्हाट्सएप के माध्यम से भेजा जाएगा. उसके लिए उसको आधा घंटा, 2 घंटा, 3 घंटा वेट करने की ज़रूरत भी नहीं है, जो अपने आप में इस मशीन की खूबी भी है.
One such deployment is at the CHC in Por. It is a small industrial village located far from Vadodara city. This health center and 5 others will each serve nearly 500 to 600 community patients daily and around 132,000 every year. Konica Minolta will be easing the lives of these patients every year through these health ATMs in collaboration with local administrations.
આ હેલ્થ એટીએમ મશીન દ્વારા જે આપણે વાત કરીએ છીએ કે સીએસસીની અંદર 300થી 400 લોકો આવતા હોય છે સારવાર માટે અને પીએસસી લેવલે 100ની આસપાસ આવતા હોય છે દર્દીઓ. તો એ ઇમરજન્સીની અંદર આ મશીનનો ઉપયોગ ખૂબ સારી રીતે થશે અને ઝડપી સારવાર માટે એનો ઉપયોગ થશે અને લોકોને डायग्नोसिस કર્યા પછી સારવાર મળશે.
These instant test results provide timely intervention and save the lives of many who do not have the financial ability to visit the health center multiple times for testing and report collection. Instant testing saves transportation costs and helps ease up the financial resources of poor households for education and other needs. These machines also help ease the testing load at the government lab, initiating health that touches every corner.
Konica Minolta.